vulgaris. I think last previous two classes you remembered well the topics we have covered, like blister disorders and some other disorders like psoriasis, eczema, scaly lesions. Now we are going to know about some infections, some permanent diseases. These things will be in the last class. Short, very, very short topics, but very, very important topics we should know. Acne vulgaris. We all know about the acne, you know, that is a very, very common skin disorder, and there are a lot of questions about this thing. But we should know how it happens. Look, acne it typically affects the face and neck and upper trunk, characterized by obstruction of the pilosebaceous follicles, creating keratin plaques over there, and then comedones, inflammation, pustules. I just request you to remember these names mostly. These comedones, 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 then inflammation, then pustules. You should remember these three things very, very importantly. So blackheads, we know about the blackheads and whiteheads. You can see many advertisements about blackheads. Read out of blackheads, no? These blackheads, actually, these comedones, you can say, these comedones are blackheads. So how this happened? You should know the pathogenesis. Not everyone suffering from acne vulgaris, mostly teenagers. So teenagers, teens, that means 13 to 19, or you can say 25 years of old. This is the sufferers mostly. So teenagers are mostly sufferers. Why? If any teenagers have any kind of hormonal imbalance like androgen excess, so androgen excess, this is one kind of hormones, no? If anyone you can see who have androgen excess, he can suffer with this acne. So you need to know which diseases causes increased androgen. You need to know which systemic diseases for MRCP, this is for MRCP, which systemic diseases can cause androgen excess. Can you name anyone so that you know, like endocrine system? You heard that androgen excess causing a pathophysiology. Polycystic ovarian syndrome. Yes. Any person who is obese, obesity. So this obese differentials one another is Cushing syndrome. Cushing syndrome. You heard about the Cushing syndrome, like cortisol excess and all other thing excess, like aldosterone, cortisol, all other thing excess, mostly cortisol excess. Here, androgen excess can be happen. So Cushing syndrome, obesity, polycystic ovarian syndrome. Another thing, congenital adrenal hyperplasia. This is also causes androgen excess. So congenital adrenal hyperplasia or any androgen secreting tumor. Androgen secreting tumor, that is very rare, but can be happened. So these are the secondary diseases can cause, you know, androgen excess, and this can cause acne. So what are the secondary causes can causes acne? There's polycystic ovarian syndrome, any obesity. So if any scenarios can be given, like a obese teenagers suffering from this type of lesions in his face, which could be inflammatory, or there could be severe pustules, comedones over there. So that should be diagnosis, should be acne vulgaris. Cushing syndrome, congenital adrenal hyperplasia, androgen secreting tumor. So you should remember polycystic ovary syndrome and obesity. These two is most important if you want to remember for part 1. So polycystic ovarian syndrome, obesity causes androgen excess, and this androgen excess can cause acne. Why? How? This androgen causes increased sebum secretion. Sebum, you know, sebum, this sebum, which residing in the hair follicle. Just beside the hair follicle, we can see one of the peak, what we can see in the first class. Just the skin. show you here the physiology. You can say here, you can see this peak. Look at this. This is sebaceous gland. This is this red one. So here, increased sebum production by whom? Androgen. If there is an androgen excess, so there could be this part. It can be blocked. Over secretion can causing blockage of pilosebaceous unit. No? Here it could be blocked, and then inflammation occurs. Then anything can happen. Also, here it could rupture in the dermis. So then inflammation can happen in the dermis also. So dermis and blockage of pilosebaceous unit can causes this type of acne formation. So we need to know only androgen excess can causes this type of problem. Okay. So what is the protective phenomenon? That is estrogen. Estrogen give protection. Estrogen decreases sebum production. Estrogen is good. It is good. But androgen is bad for acne. Okay. So secondary diseases, we need to know what causes androgen excess. You will very clear in endocrine system by knowing this pathophysiology, how androgen excess can occur. These diseases like PCOS, polycystic ovary and obesity, congenital adrenal hyperplasia, Cushing's syndrome, and also the androgen secreting tumor. So we need to know about these things. So let's go to the acne vulgaris. So comedian pustules, we need to know. Now we will go for the. We know androgen excess causing acne. It's clear, I think. Secondary diseases, now I think it's clear. So there are two parts like open and closed comedons. With or without, you can just read it out. But moderate and severe acne, you need to know what is moderate, what is severe. Because the treatment is different here. Only papule and pustule over there. Here, look, mild to moderate acne. How you can say mild to moderate acne? Only just they will say papule and few pustules. Few pustules. Not very severe or very lot of pustules. Papules are more. So papules are more than pustules. It is mild to moderate, you can say. But when it's severe, there would be lot of pustules. Lot of pustules. And papules are less than pustules. So pustules, you need to know about pustules are lot or not in the question, because the treatment is different. Okay, so how mild to moderate you will, like a 12-week course of topical combination therapy should be start first line. First line is not only the benzoyl peroxide, it is topical benzoyl peroxide and topical adapalene or topical clindamycin or tretinoin or benzoyl peroxide or clindamycin. Any one of these or. So most common is topical benzoyl peroxide, BP, benzoyl peroxide, and another one adapalene. Adapalene. So you need to remember this name. This is first line. It is so mild to moderate. Okay. So you can also use in case of pregnancy only topical benzoyl peroxide, not in like anything else which is contraindicated. So at that moment you can only use topical benzoyl peroxide. We'll know about that later. But right now, in just answer mild to moderate and severe acne. Okay. So in severe acne, you should go for actually this combination. In third, fixed combination of topical adapalene, topical benzoyl peroxide, or oral. You will give oral or not. This will confuse you in the questions. So in case of severe, you should remember only one thing, that is topical benzoyl peroxide plus oral doxycycline. you will find this one mostly. So you will give a topical and also a oral antibiotic in case of severe. And in case of moderate or mild, you will give only topical. And that should be a combination. So that will be an easier thing because it is a complex thing, because anyone can use any of the combinations. But in most of the questions answers, you can find in case of mild to moderate only topical, two topical thing, topical plus topical. And in case of severe, you should answer topical with oral. So oral antibiotic and topical benzoyl peroxide. So this would be the answer. And here topical antibiotic and another thing, benzoyl peroxide. So this could be easy. Remember, for the remembrance, that would be easier. So topical, oral. You should remember these things. They're like mild to moderate, I will go for topical, and in severe, I will go topical, oral, and oral is antibiotic. If you give one antibiotic in oral, you should never use topical antibiotic. You will, if any, this is a rule. Like if you prescribe one antibiotic orally, you should not prescribe topical antibiotic. You should prescribe other thing topical. Like here, benzoyl peroxide is the sensitive one, good one, which decreases sebum production, which can causes decreases inflammation. So that's why it's very good. So benzoyl peroxide, topical and oral. So I will advise you to remember topical, oral, just this one. And you know that benzoyl peroxide is very common. So you can put it on the answer. And you know here benzoyl peroxide plus oral doxycycline or tetracycline or any limecycline. Newer name, limecycline or limecycline, they can tell. So limecycline, you can answer. Okay, so this would be easier whenever you read topical, and topical oral. Okay. So there are some few important points where you cannot use some doxycycline, tetracycline, like it should be avoided in pregnancy. Okay, and children's and pregnancy at that moment, oral so topical benzoyl peroxide plus erythromycin. For pregnancy, you should remember oral erythromycin. Okay, erythromycin. Rapidly, repeatedly, you should tell. Okay. So this is very, very much important. Like minocycline, you cannot use if there is any pigmentation because it can cause irreversible pigmentation. At that moment, you cannot use. So you just need to read it out so that you can answer. But oral antibiotics and topical antibiotics should not be used in combination. Two should not be combination. These things you should remember. So there are some alternatives you need to use, like you know that combined oral contraceptive are an alternate to oral antibiotics. So sometimes you can what you can use in case of you know that contraceptive. So this is very important, cocyprindole Dianette, because it has anti-androgen properties. So anti-androgen properties, you should remember this name only, cocyprindole. So you should remember that for acne, we should use the contraceptive cocyprindole, only this thing. And oral isotretinoin we can use, but it is a specialist supervision because pregnancy contraindication. So isotretinoin, you should just remember the name. This is similar criteria where you can use it topical, and oral like that. So no need for further. Just you need to go for diagnosis first. Secondary diseases, you should go for diagnosis. How you can diagnose acne? Like pustules, papules over the face, and which causes in teenagers mostly. And in female, acne vulgaris mostly after 25 years. Most common. Because at that moment, after 25 years, females have androgen, increased androgen physiologically. So you need to know that thing also. Now we can go for the acne rosacea. more far common than the acne vulgaris. This is most common question actually, the question for MRCP. You can find around 10 questions in any question bank of acne rosacea. So you need to remember the acne rosacea mostly rather than the acne vulgaris. So whenever you remember, how you can remember this acne rosacea? FETPP. FETPP. You should remember FETPP. Like whenever you see acne rosacea, you should write it down. FETPP. Is there anything else in the scenario? FETPP. So what was that? Flushing. F for flushing. E for erythema. T for telangiectasia. So F for flushing, E for erythema, T for telangiectasia, immature blood vessels. So FET PP is papule and pustule. One P for papule, another for pustule. But this FET, FET is very, very common in acne rosacea. Whenever you found acne rosacea in the option, like in the option you can see there is acne rosacea, you should just write there FET. Is there any FET over the question, like flushing, erythema, and telangiectasia, like immature blood vessels? If these three present, it will be the answer acne rosacea. No need to find out the whole scenario. Only FET, if you found, it is conclusive that it is acne rosacea. So you can easily answer acne rosacea, I think. Then, if you remember FET, FET, and PP, you know, papule and pustule, both in acne vulgaris and other things. Flushing, erythema, telangiectasia. So again, you should read repeatedly flushing, erythema, and telangiectasia. Flushing, erythema, telangiectasia. This is acne rosacea. So you need to know the treatment of acne rosacea. It is not similar like your acne vulgaris. Acne rosacea treatment is just different. Look, the treatment. Daily application of high factor sunscreen. These are the not first line treatment. The first line treatment is, you can say, only flushing and erythema. Then you can give some topical brimonidine gel, or you can, brimonidine is a topical alpha adrenergic agonist. So only mostly mild to moderate questions are mostly present. So topical ivermectin. No one heard about the topical ivermectin. So topical ivermectin is the first line. For question answer session, you need to know about topical ivermectin. Whenever you found FET, the answer should be topical until severe. It is mild to moderate. Mild to moderate. They will not give you diagnosis. They will give you FET, flushing, erythema, telangiectasia. Now, what will be the treatment? Treatment first line, topical ivermectin. Okay. So if there is no topical ivermectin over the stem options, then what will be topical metronidazole? You will never think of like that. The topical metronidazole can be used, but in the answer that was used topical metronidazole. So topical metronidazole will be the answer. And in case of severity, if severe papule and pustule or acne rosacea, then topical and oral. Whenever severe, you should remember topical and oral. So this is the rule. Like acne vulgaris, acne rosacea, both rule.
Yes, a 54-year-old lady attends with a rash. She describes a facial rash present for several weeks associated with flushing. On examination, there is erythematous papulopustular rash with telangiectasia across both cheeks and nose. Given the likely diagnosis, which associated complication may she also have? Blepharitis, parotitis,
So what is the diagnosis here?
Acne rosacea.
Okay, you can find the FET, no? Flushing, erythema, telangiectasia. So diagnosis acne rosacea. Mostly treatment will become in exam, but some complications can be there, like blepharitis, conjunctivitis, mostly. blepharitis, conjunctivitis. Blepharitis, conjunctivitis, these things are the complications. Here in the slide, keratitis, conjunctivitis, blepharitis. You need to know the complications also. So if they give any type of which can be treatment, so you should know the fate. Then you can go for topical metronidazole or ivermectin or azelaic acid. And in severity, topical plus oral. So the rule is like that.